Good morning and welcome to the COVID-19 talk with local health authorities, not department. I have with me Dr. David Persse, representing the City of Houston, Dr. Umair Shah, representing Harris County. This is sponsored by the Rotary Club of Houston, and a big thank you goes out to President Kathy Finninger, who collects questions from various members to ask these health authorities. My name is Stephen Williams, representing the City of Houston Health Department. Case increases. There's been a lot of talk about that. And the question here is, are we about ready to overrun the ICU capacity?
So we're not ready to overrun it. There is still capacity. And of course, there are a bunch of different sources of information you can look at. And so, but basically across the region, if you look at Harris County, you look at a 9-county region, there is capacity within the ICUs. The problem is that more and more people are being admitted to the ICUs with COVID at the same time that the hospitals have started going back to elective surgeries and other things. And so you've got two things that are sort of starting to consume capacity. Now, there is still vacancy in not all. There are a couple of hospitals where the ICUs are full already, but across the region there's ICU capacity.
And so it's the regional capacity that we look at.
That's right. So at your particular hospital, there may not be an ICU bed right now.
Initially, there were some cases connected to religious services. Anything recent?
I don't think of anything
well,
that can connect to that religious service.
So early on, yeah, we did have services that were faith-based that were leading to, or somebody that was there that was COVID positive, and then we had to do a lot of real awareness out to the community. We are still having some of that. Obviously, some of the faith services went virtual for a period of time, and I think the answer is that regardless of whether you have seen a case or haven't seen a case yet, that likely when people gather, you're going to start to see cases in those settings moving forward. And so we want to make sure everybody is using the right preventive precautions.
Dr. Persse, you addressed concerns about a new rise in cases because of protests and said, if it stays at this sort of same rate of increase, then I definitely won't be able to say we can blame the protests. If anything, it's going to be reopening of society and people becoming fatigued, if you will, with the precautions we've asked them to take. Phase 3 openings in Texas began June 3rd. What are your thoughts at this point? I guess this tells you that people are listening to what you're saying.
Yeah, that's good to know, right? Yeah. So I'm glad. So what I think we're seeing now is the impact from when, in the early to mid part of May, when people started getting out and interacting more frequently. And many of those folks wore masks, but many of them didn't. And I think that's what we're seeing now. It takes generally at least 2 weeks before you see the impact. And so there are those who have wanted to say that the increase in hospitalization related to the protests, it's too early for that. Not only that, but the protests occurred over a very narrow period of days, right? Mm-hmm. Whereas the reopening sort of gradually, the governor's order for May 1st and then May 18th, those were like landmark dates, but people's behaviors didn't change just on those days, gradually. And so that's why we're seeing this gradual. If time goes on, all of a sudden we see this huge spike, exactly, that we could link back to the protest. And when you talk to the people who are infected, they say, yeah, I was at the protest, then we could. I don't think we're going to see that. And the reason is, at least here in Houston, I thought a lot of people at the protest wore masks. Mm-hmm. So I'm not anticipating a protest-related spike. I'm seeing this more gradual, continual, unfortunately, rise in numbers, cases and hospitalizations.
You're relating that to reopening overall.
Yeah. What I'm calling it is the layering effect. It's a layering of reopening May 1st forward, as David just mentioned, and then on top of that, you have milestones. You have Mother's Day, Memorial Day weekend. You've got graduations, you've got other activities that are happening, and then you've got, you do have protests or marches that are happening. We had the funeral just this week. We've got a lot of things that are happening, but it generally takes a few weeks after whatever that event is, and also gradual nature of just people not rushing into a restaurant immediately. They sometimes take a few days to let's let the other people go in first, and now let's start to get into, and all of that comes into play. So.
You're right.
And we're going to see with Father's Day, we're going to see with 4th of July weekend. Yep. These are the kinds of things that are coming up as well.
Yeah, that was going to be my next question. Father's Day and, of course, July 4th, which is a big celebratory day, is coming up. Say if we continue to see this rise in cases in the next 2 weeks, what would be your advice about July 4?
I don't think the advice is going to change anything. People, the other thing which hasn't been talked about because it's only been anecdotal, but the cases of patients that are being hospitalized now, we're finding that they tend to be younger than the ones that were being hospitalized about a month ago. That again goes along with the phenomenon of people getting out and, because if you watch the news, it was people in Galveston beaches, it was people having parties, so on and so forth. And they tended to be the younger folks. At the same time, we've done a much better job. The nursing homes in particular have done a really good job of really getting strict with all of their precautions. So as we move forward, that's the thing that makes the difference, is the wearing the mask, it's the social distancing, it's the washing hands, it's the same sorts of things that as individuals we have control over. The government really doesn't have control over that, at least not the local government doesn't have control over that, but it's the individuals that have to take that responsibility and to take those actions.
Yeah, Stephen, it's like, it's big P policy that policymakers are, whether it's at the state level or elsewhere, and then it's really the small p of individual policies or procedures or protocols that people in either their establishments or individuals are taking going into those establishments or those activities. That's why all of us have a role to play in fighting this virus in our community. Every single person.
There's one layer in between those two that I'd like to reinforce. It's employers.
Yeah,
so employers,
right.
particularly in public-facing industries, those employers, I would really strongly recommend that they get insistent that their employees wear masks, if for no other reason to set the example.
That's right. And if they're sick, not force them to come to work.
Right.
Make sure that they're permissive about that, and also make sure that they worked out how to get them tested.
Right, exactly.
Yeah.
So, Texas has seen a 36% increase in COVID-19 related hospitalizations since Memorial Day. When will we need to start closing what we have just reopened?
Well, that's a difficult, so a couple of things. Well, one is, unfortunately, that's not our decision, that's not a local decision, that's the governor has taken that. Number two is what I'm hearing from the business community is that they have no desire or intention to do that. So things would have to get pretty bad, I think, before that occurred. But that brings us back to what we were just talking about. It's the individuals who need to take responsibility for their own health and the health of those around them. That's the only thing that we have to do.
Right.
Okay, we're going to continue with that in a minute. You have been watching the COVID-19 talk with local health authorities. We'll be right back in a few minutes.
145 over 92.
180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself, I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. Coming back. Ask your doctor, check your blood pressure.
My grandma always says everyone counts, and everyone who lives with us is special. Like my aunt, who took me on my first bus ride to the library, or my older cousin, who walked me through my first day of school, even my mom's friend and her baby who live with us.
The census informs funding for schools, roads, healthcare, and more. So count everyone in your home, including all children on the 2020 census. It's your chance to help them for the next 10 years. You can respond online, by phone, or by mail. Shape your future. Start here. Learn more at 2020census.gov.
Welcome back to our COVID-19 talk with local health authorities. And right before the break, we were talking about reopening and the possibility of closing what we just started.
Yeah, I just wanted to add right before the break what David was saying is that it is not right now in our our power, if you will, or our authority, because it is at the state level. But I do think that we have the ability to continue to remind everybody of why what we're seeing is really worrisome. And the trends are not going in the right direction right now. And we would expect some of that with reopening. We'd expect some of that with people intermixing and getting back to life. But the trends are not going in the right direction. And we certainly don't want to continue to see them go in the wrong direction and go backward, where we have to make these recommendations for drastic steps. That's why every single person in our community has a role to play in really fighting this infection. And I wanted to make one other comment, which is when we wear masks and do things in the medical community, we're very meticulous about things. Like if you go into a patient's room, you don't just wear the gloves or the mask like half the time. Or you don't say, okay, I'm going to wear it for this patient, not that patient. You do it all the time. And what we have to remind people is that just because you wore the mask in the morning and you said, okay, I'm not going to do it in the afternoon when it's hot, or just because I took my hand sanitizer yesterday but not today when I go out, that doesn't work. It has to be all the time in order to protect ourselves.
And there is an element of fatigue that sets in. I can tell you, I want to take my mask off.
Yep.
But I won't. Okay, testing. The Houston Health Department is expanding the number of COVID-19 testing sites starting June 8th. Why?
Well, testing is important because this is how, people who, think that they may be infected can find out whether or not they're infected. And you may think you're infected because either you have symptoms or because you think that you got exposed somehow or another, whatever that may be. And people want to find out if they may be infected. If they come back and the test is positive and they were infected, then they absolutely know that they need to quarantine, to do those things to protect their family members, watch their own health, and if they need to go to the hospital, they go to the hospital. But that doesn't mean that people who don't test don't need to do those same things. All of us need to be protecting because of this issue of the pre-symptomatic and the asymptomatic spread of the virus, which is very real. So the more testing we can do, the more people who are concerned are going to get their answer. It also helps us from the health department side to get an idea as to how much spread there is within the community, and know whether or not things that we're doing are improving the situation, or things we're doing are not working as effectively as we need them to.
Yep.
Okay, and actually I'll add on to that after I ask y'all this question. The Texas Division of Emergency Management indicates an increase in testing for underserved and minority communities that have been disproportionately impacted by the virus. How will this be determined, and what areas of the community will receive more testing?
Well, the way that we've been working with our state partner on this is to help guide them on where in the community that they can set up shop, where they can test, and to help us. So the Texas Department of Emergency Management, TDEM, has agreed to help communities across the state. And in our communities, it really allows us to, they don't know in a big county like ours, right, the size of Rhode Island, population larger than 25 states, well, where exactly do we go? And that's where the two health departments get involved, and we can actually help them put the testing efforts in communities that have, or we believe have, disproportionate impact. And that, I think, is where the health departments get involved.
Yeah, one of the things that we did in the Houston Health Department is look at the testing penetration by zip code. Mm-hmm. We also looked at communities that would have been severely impacted if individuals got COVID, and that study was out of UT Dr. Stephen Linder. And so we overlaid those two, the results of those two factors, and then we prioritize those neighborhoods. There have been some indications from various advocacy groups, various grassroots communities that even though the penetration rate in a broader zip code might have been okay or acceptable, there are really subpopulations within those zip codes that really need targeting. And so we have been working with those groups to try to ensure that we're testing in those communities.
That's good, yeah.
Oh, Persse, you're going to love this one. Prisons are hotspots. It is because of is it because of recent testing or cases they're increasing?
What was the first word? What's our hotspots?
Prisons.
Prisons. Oh, yes.
You could say prisons, you could say jails.
Yeah, yeah.
All right.
So, well, the thing about a prison or a jail is that it is, the physical plant and the operations are perfect for viral spread. You get a large number of people in a very small space, and they're there for many, many hours, I would say 24 hours a day. And so that's so it's not terribly dissimilar from a cruise ship, right? I mean, it's not nearly as luxurious, but or enjoyable. But the point is, you got a large number of people. And where else you see this is we see this. We'll probably talk about this at some point. Is that if we have a hurricane, we have shelter operations. Large numbers of people in small places where they're there for hours and hours on end. And so that's what makes them hot spots, because the virus takes advantage of that and it spreads. And so these are real challenges, because the jails in particular, there is a structured environment, and there's all kinds of things that go on as you manage a jail that we on the outside world have no appreciation for. I'm learning it, but it is a completely different world. I don't recommend anybody wind up in jail.
Well, and then just the flip side of that is nursing homes. Because nursing homes, it's not just what you have in terms of the facility issues, infection control, which is hard enough, but you have fragile populations, and elderly populations, and also those with severe underlying health conditions, which, by the way, is where COVID-19 has its most serious risk for complications. So again, these are hot spots across the country that we've been watching, and nursing homes are also very, very critical to what we're doing.
The Lancet Medical Journal retracted and apologized that their previous analysis of hydroxychloroquine led to an increased risk of death. Where does this leave doctors who were afraid to continue using it?
Well, I'll say this is why it's been really hard. This pandemic, we've seen a lot of information that's gone out, a lot of activities that have gone out, a lot of science that's gone out. Hydroxychloroquine, yes, it's harmful, and then they walked it back. And I think where this leads us is that we still don't have all the information. And so I know there are going to be doctors that are going to be using it, others that are not going to be using it, and the science is still pending of what the effectiveness is and the safety in COVID-19.
You have been watching our COVID-19 talk with local health authorities. We'll be right back in a few minutes.
Wash your hands. Scrub them while you're singing the song. Wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1.
Taking care of yourself is also taking care of others. We are all in this together.
How does the 2020 census affect representation? There are 435 seats in the House of Representatives. These get distributed to the 50 states by population, and an accurate census response helps your state get the right amount of seats. States with smaller populations get at least one, while states with larger populations might get more. Shape your future. Start here. Visit 2020census.gov.
Welcome back to our COVID-19 talk with local health authorities. I have a question that came up on the message board from Peggy Foreman. Some testing is a joke. I have a friend who was tested and did not get results until 10 days later. He had no symptoms but tested positive. Though he was in contact with got tested through a state-sponsored test site and were told test results would be back within 96 hours. It is now 18 days with no COVID-19 results. It's insane. Yeah. We've had those.
Yes, and we're concerned about that. And she's absolutely right. We should be at this point in our country that you should not have those kinds of delays. But the unfortunate reality is we're still seeing those delays. We're seeing lab results that are coming in. We're getting chaotic lab results. We're getting inconsistent lab results, and we're getting delay in lab results. That's to the health department, and to the individual, it's a very similar thing. So she's absolutely right. We are hopeful that our sites that we're not having those kinds of delays, but even there, we can't completely assure it when it's coming from some of our other partners that are doing those testing. So she's right.
What can people do about if?
Well, I'm not sure what people. First of all, make sure that the mechanism by which you need to be contacted, if it's a phone number or if it's going into a web portal, that you make sure that you do what you need to do individually. But then it's really up to health departments, if we're running those sites, for us to be able to make sure that's happening on a timely basis. And if it's not run by us, then honestly you have to go to the people that ran that test.
That's right. That's right.
Okay. Governor Abbott announced that the Texas Department of State Health Services is distributing additional cases of antiviral drug remdesivir to 85 hospitals across 34 counties in Texas. Is this the new protocol?
I don't know if it's a new protocol, but there is evidence that suggests, and this kind of goes back to the earlier comment about getting data out too quickly, but this has been sort of, I don't want to say rushed, but it does appear that remdesivir does provide benefit. It is not a cure-all, it is not a magic bullet, but and to give it to patients earlier in their illness, it appears to work a little bit better, and it's not 100%, but it is helpful. And this should not be a surprise. So remdesivir is a drug that was designed for a different virus, seems to have some impact here, so we're using it. 2-3 years from now, we may have a much more effective drug that is targeted specifically at COVID, but this is what's available today.
And just to point out, it's not a pill. This is an injectable.
Right.
So it's not like you can go give it to somebody in the, out in the community. This is in a hospital setting.
Right.
Yeah.
Okay, earlier during the break, we were talking about asymptomatic and symptomatic and the rate of transmission.
Yeah. So the World Health Organization had walked back a comment made by one of their, I believe it was one of their lead epidemiologists, who was responding to a question from a reporter, and the epidemiologist said that asymptomatic spread was, I think she actually used the word rare, but it was the presymptomatic spread. And so that was, I say that asymptomatic spread was rare, is counter to everything we've been hearing. So she was challenged on that. The World Health Organization was challenged on it, and she had to sort of walk back her comment a little bit. What she was saying, and I don't know what she's basing it on. So this is one thing. I only saw her statement. What sounded like she was trying to say is that she was looking at some evidence to suggest that people who are asymptomatic, meaning that they don't have symptoms now, but these are people who never develop symptoms, that those folks don't appear to be spreading the virus as much as the people who are pre-symptomatic, which means on any given day they don't appear to have symptoms, but 2-3 days later they do. Okay. And so between those two groups, looks at the pre-symptomatic are much greater risk. The problem is that on any given day, you don't know who's pre-symptomatic versus who's asymptomatic. There's no way to know.
That's right. And this is why, Stephen, I'll add to Dr. Perse's comment, which is inconsistent messaging. We've been saying at the national, state, local level is a problem, but now let's add in global, national, state, local, because what happens is when you get inconsistent messaging, the individual at the community level is then confused and says, well, gosh, they don't have their act together. I'm not going to follow it. I'm not going to listen. Let them figure it out. That's what puts people at risk. And that's why we want to make sure people don't get complacent, even if the messaging has changed or you've got inconsistencies.
Okay, the next question is more practical. It's about grocery stores relaxing requirements to wear a mask. And I think it's an expression of frustration amongst this person. Can't someone encourage these stores to shape up?
Well, I wish we were empowered to do so.
Well, we can encourage.
Yeah.
So listen, David, we encourage you to continue to.
Yeah, if you own a store of any kind, of any sort of business that interfaces with the public in particular, we would ask that you make sure that your employees all wear masks and have signs up encouraging your patrons to do the same.
And I concur. So there you go. We've got the encouragement. The issue is we can't require it, and so that's where I think it is concerning to an individual who really wants to do the right thing, and others around them are not.
Okay, we've got about 3 minutes. In restaurants now, there can be more than 10 per table. How does that assist in distancing?
It doesn't.
It does not.
Clearly, yeah. You know, all right, so here's where I may get myself in a little bit of trouble. When the governor's order came out, he even said that, you know, we're going to take a look and we're going to see what happens, and then we'll go to the next. And I thought that that window, particularly for phase 1 of 18 days, was too short because I knew people weren't going to go from 0 to 100 miles an hour in day one, that they were going to slowly start increasing their activity. And so we won't know the impact of that until now. And so here we are in early June, and now we're probably seeing the impact of that. So that's why I thought that the 18 days was too short. And we've gone to phase 2, and now we're in phase 3. And so this is what it should have been expected, right? And this is what was foreseeable. So now we're in a situation where society has gotten to a point where people are out and they're doing things, and Lord knows the economy had to get going again. I get that. But if the economy is going to keep going, then people have got to start doing these things that we're talking about, or otherwise we're going to wind up in serious trouble.
Okay, Governor Abbott says that we have about 2,000 contact tracers. New York hired 17. Don't we need more in Texas? We got 2 minutes.
Well, we have 300 at Harris County. I know you all are ramping up yours, and across the state, 2,000 is what the state is saying. 1,100 of those are at local health departments. Stephen, you and I were on a call yesterday. We heard that. You know, the answer is we don't know what the total capacity around the state is going to be, but I'll tell you, if we continue to reopen and continue to have increased transmission, we're going to need more.
Okay. Yeah, the other thing is the number of contact tracers you need is directly linked to how many cases you have.
Yep.
So the more cases we develop, the more contact tracers we're going to need, or vice versa. We're not going to have enough.
Right. That's
Okay,
right.
Dr. Peter Hotez says the one thing that I'd like to see move ahead faster is the out for syndromic surveillance. Please explain.
Is the what of syndromic surveillance?
An application for syndromic surveillance.
Right.
Well, you know, I'll just say that Dr. Hotez, Dr. Persse and I, you know, actually we're in touch with him a lot. He's fantastic. He's right. Syndromic surveillance applications, if there are ways to have stronger ones that allow us to really detect what's happening in settings, whether it's in the healthcare setting or beyond, absolutely we would love to see those. Unfortunately, not all those work as well, and the signals aren't as strong.
What is the city and county doing with those arrested in prison and hell awaiting bail? Jails are congested and not conducive to distancing.
Yeah.
You said that earlier.
Yeah. So with the Harris County Jail, so that falls within the City of Houston, so our health department, the City of Houston Health Department, has been working with them, and Harris County Public Health has been brought in as well to assist. And whether you're there on bail or you're there because you've been convicted of something, we're doing all kinds of things, setting in a new infrastructure, getting fit testing done, closely monitoring people for symptoms. There's quarantine, there's isolation. It's a whole different community in there, and they have all the same things going on that we're trying to get into any other community. It's just a different environment. It's
and the County Commissioner's Court docket from this past Tuesday was extensively about law enforcement, and so I would recommend viewers actually look at that as well.
Okay, you have been watching our COVID-19 talk with local health authorities. We have with us Dr. David Persse, representing the City of Houston, and for Harris County, Dr. Umair Shah. And we want to thank the Rotary Club of Houston for continuing to sponsor this talk with our health authorities and President Kathy Finninger. My name is Stephen Williams, Director, Houston Health Department. Thank you for joining us.
Happy birthday yesterday.
Thank you. Yeah.